Have you ever looked down at the toilet and noticed your pee looks cloudy? I know, it's not exactly dinner table conversation, but it's something a lot of us have wondered about. So, what's actually happening when your urine loses that clear yellow and suddenly goes cloudy? Let's dig in, and trust me, what you learn today is going to stick with you. First off, healthy urine is usually clear or pale yellow. That's thanks to the balance of water, waste, and certain pigments your body produces. But if bacteria sneak their way into your urinary tract, things start to change, sometimes dramatically. Here's the thing, your urinary tract is normally a bacteria-free zone, but sometimes bacteria like E. coli manage to find their way in, usually from the gut, and start to multiply. When this happens, your body instantly goes on defense. White blood cells race to the scene to fight off the invaders. And when you have a ton of white blood cells, plus the bacteria themselves and all their waste, your urine can turn cloudy. It's like a microscopic battlefield, and you're seeing the aftermath every time you pee. But let's get a bit nerdy for a second. What exactly are those bacteria doing? First, they latch onto the lining of your urinary tract using tiny hair-like structures called pili. Then, they start multiplying and releasing toxic byproducts, which can damage your cells. That's what kicks your immune system into high gear. The result? Pus cells, mostly dead white blood cells, start floating around in your urine, making it look cloudy. Sometimes you might even notice a funky smell or a burning sensation. It doesn't stop there. Some bacteria can also break down urea in your urine and produce ammonia, which further messes with the color and clarity. And if you've ever seen little particles floating in the bowl, those could be clumps of bacteria, immune cells, or even bits of tissue. Kind of gross, but honestly, it's your body's way of showing it's fighting back. Now, cloudy urine isn't always due to bacteria. Dehydration, certain foods, or even medications can play a role. But if you're noticing it often, especially if it comes with pain, urgency, or fever, it might be time to check in with a doctor. As med students, it's important to know these subtle signs and what they mean for your future patients. So next time you see cloudy pee, remember, it's not just a color change. It's a sign of a microscopic war zone and a clue that your body is putting up a fight. Stay curious and keep asking questions, because even the little things can tell us a lot about what's going on inside.